The connection between obesity and cancer runs deeper than just excess weight. It operates at the hormonal level, where imbalances in key regulatory signals create conditions that allow cancer cells to thrive. Fat tissue is not inert. It acts as a dynamic endocrine organ, producing and influencing a wide range of hormones and signaling molecules. In individuals with obesity, this hormonal activity becomes dysregulated, triggering a cascade of effects that disrupt normal cellular behavior and promote tumor development. One of the most significant disruptions involves insulin. Obesity often leads to insulin resistance, causing the pancreas to produce more insulin to compensate. Elevated insulin levels, along with increased insulin-like growth factor 1, IGF-1, stimulate cell division and inhibit apoptosis, the process by which damaged or abnormal cells are naturally removed. These conditions increase the risk of cellular mutations persisting and multiplying, laying the foundation for cancer formation. Insulin and IGF-1 are particularly implicated in cancers of the colon, pancreas, and endometrium, where cell growth is strongly influenced by these growth signals. Estrogen is another key hormone affected by obesity, especially in women after menopause. Fat tissue becomes the body's primary site of estrogen production once ovarian function declines. This leads to chronically elevated estrogen levels in women with higher body fat, which in turn promotes the proliferation of cells in estrogen-sensitive tissues, such as the breast and uterine lining. This prolonged hormonal stimulation increases the likelihood of DNA damage and abnormal cell growth, both precursors to cancer. Estrogen-driven cancers are among the most common and deadly in postmenopausal women, making this hormonal pathway a critical mechanism in obesity-linked cancer risk. Leptin, a hormone involved in appetite regulation and energy balance, is also elevated in individuals with obesity. Although originally thought to simply signal fullness to the brain, leptin also affects immune function and cell proliferation. High leptin levels have been associated with enhanced tumor growth, angiogenesis, the development of new blood vessels to feed tumors, and suppression of anti-tumor immune responses. Meanwhile, adiponectin, a hormone that protects against inflammation and supports healthy metabolism, is typically reduced in people with obesity. This imbalance between pro-growth and protective hormones further skews the internal environment toward one that supports cancer development. Chronic low-grade inflammation, another hallmark of obesity, exacerbates hormonal disruption. Inflammatory cytokines released by fat cells and immune cells residing in fat tissue can interfere with hormone signaling and further destabilize cellular processes. Inflammation increases oxidative stress, damages DNA, and impairs the body's ability to detect and eliminate precancerous cells. Over time, this persistent inflammatory state acts as a catalyst for cancer progression in multiple organs. Despite the clear hormonal mechanisms at play, the role of obesity in cancer development is still widely underestimated by the public and underemphasized in clinical care. Many individuals don't realize that the hormonal disturbances caused by excess fat are not limited to metabolic diseases like diabetes. They are actively reshaping the risk profile for multiple forms of cancer, often with lethal consequences. Yet obesity continues to be framed largely as a lifestyle issue rather than a complex biological condition with systemic hormonal effects. What makes this particularly dangerous is that these hormonal shifts begin early in the course of weight gain and may persist even if some weight is lost later. By the time cancer risk becomes evident, the hormonal groundwork may already be in place. This underscores the importance of early prevention and sustained, long-term strategies for weight management before hormonal imbalances become entrenched and irreversible. Without greater awareness of how deeply obesity influences hormones and how those hormones in turn create a cellular environment favorable to cancer, prevention efforts will remain incomplete. This isn't just about weight. It's about the invisible hormonal machinery that, when disrupted, sets the stage for disease at the cellular level. Until that understanding becomes central to both public health messaging and medical practice, the hormonal link between obesity and cancer will remain a largely unaddressed threat.